Out of your medications, which is the one that is most difficult in knowing information about, or which chronic condition is most confusing?
I would say my Lipitor generic medication because I've heard that your LDL cholesterol is hard to lower without medication, but I've also heard that you can lower it without medication. So I get confused on that, whether or not I should take the medication or not. I'd rather not take it, but
And what is most confusing about your medication or your chronic condition?
the most confusing, well, you never really know why you have LDL cholesterol. It could be genetic, it could be your diet. Um, I always wonder if there's like a test that you can figure out why you have LDL. Is it your diet or is it genetics? So
And what kind of information would you like to know that would make your medication or chronic condition less confusing?
again, just is there another option than to take cholesterol medication? I mean, can I reverse it, you know?
And how safe do you feel in your day to day life when you're out in public or running errands? And how does your safety influence your health?
I feel safe for the most part. At night, I do try not to go out at night alone. Um, so that would probably be the only safety concern is being alone at night as a woman.
Um, what kind of access do you have to nutritious foods and how do you take advantage of that?
We have access to nutritious foods here in our city. I try to get organic produce if it's available. If not, I usually will pick what's in season. But yeah, I say we get pretty good, um, quantity of good produce in our town.
What are your sleeping habits like and how have they impacted your health?
I try to get 8 hours of sleep. I don't always. I'm usually in bed by 10. That doesn't mean I necessarily always fall asleep at 10. I might look at my phone for an hour or two. So, but I do try to get 8 hours of sleep. And it does help at my age.
Um, how has your income benefited you or given you disadvantages regarding access to healthy foods and health care?
Well, I don't think that my income has impacted my ability to eat healthy. I think anyone can eat healthy on any income. You just may not be able to get as much produce, but I do feel like you can eat healthy foods no matter what your income is in our area.
Um, have insurance coverage or benefits impacted health care for you in any way?
Not for me in any way, no. No.
So regarding like school lunches and nutrition, when you were growing up, what kinds of foods did you eat in school and how did they contribute to your health?
Well, my mom was a health nut, so we always had an apple and a sandwich and some vegetables. Um, we in a paper bag or a lunchbox. So I always ate healthy growing up.
And did you have access to education on health and well-being growing up and as an adult?
Growing up, I don't remember. I honestly don't know. I don't remember if we had access to. I mean, my mother was pro eating wisely, so she taught us at a young age to eat your fruits and vegetables and the pyramid, if you will.
What kinds of sports and activities did you participate in growing up?
Well, I was a dancer, I was in ballet, I was in tap, I took baton lessons. Um, I was a skateboarder for a while. I roller skated. I was on the softball team. Um, that's about it. Yeah.
And what activities do you do today to benefit your well-being?
I try to walk at least 30 minutes every day. And that's pretty much it. And I try not to sit down too much during the day.
And what kinds of resources do you have access to regarding health care and receiving treatment?
Oh, I mean, I do research a lot on Google. Any issue I have, I don't believe everything I read, and I do try to go to my doctor regularly, so.
And have there been any barriers or disadvantages when trying to receive health care?
Not for me. Not yet. Not for me, no.
Are there any pleasant or disappointing experiences you've had with health care?
No, not for me. There has not been, no.
When you were growing up, how did your schools help students dealing with chronic illnesses or learning disabilities?
I think the only thing they had was the special education class for learning disabilities. I don't believe they did anything special. I went to a small school, so maybe there weren't as many options. And there was always the nurse. If you were sick, you could go lay down. You didn't feel good, and we did have a nurse, like everybody else. But
Did you have access to higher education, and were you the first generation to pursue higher education?
I did have access, and I went to college. My father is a college graduate as well, so I'm not the first generation.
What have been some of your experiences with doctors, like in the healthcare system?
Experiences? Well, I guess I can just tell you a couple of things that maybe happened to me illness-wise. So when I was little, I broke my collarbone, fell off my bike, so I had to go to a doctor for that, the emergency room. So I have been in the emergency room, and that was, I don't remember it, but I don't remember anything horrible about the emergency room. I had delivered 3 babies, so I had a gynecologist. And then I have my PCP, healthcare provider, which is a woman. She's actually a nurse practitioner, and she's a very nice, kind person. She'll talk to me as long as I want to talk, So I really don't have any bad experiences.
And what have been some of your experiences with nurses?
Nurses? I remember nurses were great when I was delivering my children. They almost did everything except the last couple minutes of delivering the baby. So nurses are great.
And what have your experiences with front desk staff been like?
Oh, I think most people are genuinely very good at their job. I'm sure everybody has their day where they're cranky, but for the most part, I think the front office staff people are professional anywhere I've ever been.
And what have been your experiences with pharmacists? What have those been like?
Pharmacists are always helpful to me. I mean, if I've ever had a question, they'll try to figure it out, give me ideas. Sometimes they'll tell me if something's not covered by my insurance, but this particular item is. But yeah, I think they're always very helpful.
And describe your ease of access to inpatient care, like in hospitals.
I think it's pretty easy, for me anyway. Yeah, I don't have any complaints. I mean, I can always make an appointment if I needed one. For like any child that was sick, I could get in right away.
describe your ease of access to outpatient care, which is like clinics.
Outpatient care. Sometimes I think the minute clinics do kind of tend to take a while. It'd be nice if they maybe had an extra staff, but I know that's not always easy to get. So, yeah, I mean, of course, when you go to a minute clinic, it's usually because you're in pain or something's hurting, so it does seem like it takes a while, probably because you are hurting. But, yeah, I don't have any complaints about that.
And how would you describe the quality of care you receive?
The quality of care I receive from my doctor is wonderful. I love her. She always answers my questions, and she'll ask me if I have any more. She's very thorough.
And how does your environment impact your health, such as having access to sidewalks and trails?
We have a lot of sidewalks where we live, a lot of trails, a lot of parks. There's a lot of places to go walk, which I do. Every day I'll pick a different park or neighborhood to walk in, so it's pretty accessible.
And how safe do you feel in your environment, and how has safety impacted your health?
I feel as safe as I can be in our neighborhood. I think it's very safe. It's probably actually it was voted one of the most safest cities in the country. So we are lucky. However, I know nowhere is 100% safe. So, but yeah, I'm fortunate to live in that city that I do.
And how easy is it to access grocery stores? And have the rise in gas prices and inflation impacted your accessibility to shopping?
We have grocery stores everywhere. We cannot walk to them, so that it would be nice if we could. And yes, gas prices? Yeah, that has impacted probably what we spend on everything, not just food, but yeah, we'll be a little more choosy with what we pick in the grocery store for sure.
And how is your access to jobs and income?
Access to jobs and income. Well, I'm not currently looking for a job, so I don't think I can answer that question.
And do you have support from people or beliefs that influence your health decisions?
I think the whole family believes in the same morals, and so yeah, I think everybody would be in agreement on any decision I had to make regarding my health.
And what are your family members' belief systems about health?
Well, we believe in going to the doctor when you're sick and getting your annual checkups, and being proactive so you don't get illnesses if you can. Be proactive where you can, and when you're sick, you definitely should go to the doctor.
And has your political affiliations or religion influenced how you take care of your health?
I don't think politics come into any of my decisions regarding my health. I'm sure it does with some people, though. I'm sure it does, but it does not with me.
And have you ever felt discriminated against or misunderstood when seeking help from healthcare professionals?
I've never felt like I was misunderstood or discriminated against, no. That doesn't mean I don't think other people probably are, but no, I have not.
And that is all. Thank you.
Okay.